Passing by a medical assistant's desk, you spot the patient schedule for next week. Listed beside the appointment dates and times are the patient's names, dates of births, and expected procedures. You inspect it closer and find out the busiest day on the schedule is your day off. Good for you! But is this schedule PHI? Do you know what PHI is? Working in a healthcare setting, you will come in contact with PHI constantly. PHI stands for Protected Health Information. PHI is health information that contains other information that identifies a person, such as a full name and date of birth, and is maintained by a HIPAA-covered entity like your organization. In our example, the patient schedule is PHI because it contains health information as well as identifying information. There are 18 identifiers that can tie an individual patient to their health information. Keep that in mind as you thumb over your health information. Anything containing these identifiers is regarded as PHI. You might come across health information that is not considered PHI. Some examples of this would be health information with no identifiable information attached, or if the health information, regardless of any identifiers, is not maintained by your organization. These circumstances will be rare, and if you ever do encounter such an instance, the safest practice would be to treat it as if it were PHI. Notify your manager should you ever come across health information like this. As an employee of a HIPAA-covered organization, it is your responsibility to make sure that a patient's PHI stays protected. You must always do what you can to make sure PHI is never seen by anyone who does not have permission to view it. Make sure to follow these basic guidelines to properly handle PHI. Access only the information you need to perform your job. Never open or read PHI that you do not need. This practice is known as the minimum necessary standard. The minimum necessary standard also requires you to keep PHI to yourself. Do not discuss PHI verbally or in writing with any acquaintance, family member, or even coworkers. If a coworker does not need to know the PHI for their job or to help you perform yours, do not disclose it. Similarly, do not let another coworker discuss PHI with you if the PHI is not important to your job. To create a culture of compliance and a positive work environment, refrain from gossiping about patients. When faxing PHI, always use a cover sheet. Keep PHI secure. Do not leave any form of PHI, including electronic, open and unattended. Stay up to date on HIPAA training. Familiarize yourself with your organization's policies and procedures for protecting patient information. Know your HIPAA compliance officer and reach out to them before executing a task if you are unsure about what your policies and procedures say. Why is it important to protect PHI in the first place? A few shortcuts or a little gossip may seem harmless, but keep in mind PHI includes patients' billing information, social security numbers, and home addresses, as well as some sensitive personal health information such as mental health history, medications, substance use, and STIs. It is vital to the patient's safety to keep this information private. Plus, medical information is highly targeted by hackers and thieves. Therefore, it is your ethical and legal duty to protect this sensitive information for your patient's safety and privacy. If you have any questions, contact your manager or